The pharmacist handed over the insulin prescription with the same practiced smile she had used thousands of times before. The customer, a retired teacher managing type 1 diabetes for 30 years, thanked her and left the store. The vial looked identical to every other insulin vial she had received over 3 decades. The packaging was correct, the labeling was perfect, and the pharmacy chain was one of the most trusted names in American healthcare. She had no reason to suspect that what she carried home was not insulin at all, but a mixture of saline solution and trace compounds designed to pass basic visual inspection. Within 6 weeks, that prescription would place her in an intensive care unit. Within 3 months, federal investigators would uncover a counterfeit operation that had compromised the medication supply of 4.2 million Americans. HealthFirst Pharmacy had grown from a regional chain to a national presence over 12 years. The company operated 840 locations across 32 states, focusing on underserved communities where major chains had limited presence. Their business model emphasized affordability and access. Generic medications were priced below market rates. Prescription assistance programs helped uninsured patients. Community health initiatives provided free screenings and educational workshops. Local news outlets regularly featured HealthFirst in positive stories about healthcare access. State pharmacy boards gave them high marks for compliance. Insurance companies included them in preferred provider networks. Everything about HealthFirst suggested a company committed to serving communities that needed affordable health care. The executive team presented themselves as reformed healthcare advocates who had witnessed the failures of the traditional pharmaceutical system. Their founder had worked in hospital administration for 15 years before launching HealthFirst, with a mission to prove that pharmacies could be profitable while prioritizing patient care over shareholder returns. Industry conferences invited them to speak about sustainable models for community pharmacy. Healthcare policy organizations cited them as examples of market solutions to access problems. The company received awards from patient advocacy groups. State governors attended ribbon-cutting ceremonies for new locations. HealthFirst had built a reputation as the pharmacy chain that actually cared. But behind the professional image and community commitment, HealthFirst operated a criminal enterprise that systematically replaced genuine medications with sophisticated counterfeits. The operation had started small, targeting expensive specialty drugs with limited patient populations. A counterfeit cancer medication here, a falsified biologic there. The savings were substantial, the risk seemed manageable, and the detection rate was low. Patients who experienced treatment failures attributed them to disease progression, not medication fraud. Doctors adjusted dosages and tried alternative therapies. The system's complexity created natural cover for the deception. Encouraged by early success, the operation expanded. Over 8 years, HealthFirst had perfected the art of pharmaceutical counterfeiting. The company established front companies that imported active pharmaceutical ingredients from unregulated factories in 3 countries. They built clandestine manufacturing facilities disguised as distribution centers. Packaging equipment produced labels and containers that were visually indistinguishable from legitimate products. Quality control systems ensured consistency in the counterfeits, not to meet therapeutic standards, but to avoid triggering obvious adverse reactions. The goal was not to create medications that worked, but to create fakes that would not immediately harm patients in ways that would prompt investigation. The target list grew steadily. Insulin became a primary focus because of its high cost, large patient population, and the gradual nature of treatment failures. A diabetic patient receiving diluted insulin would experience slowly worsening blood sugar control over weeks. They would report the problems to their doctors. Dosages would be increased. Additional medications would be prescribed. The cycle would continue until serious complications emerged, but by then, the connection to counterfeit medication would be buried under months of clinical complexity. HealthFirst calculated that for every dollar spent manufacturing fake insulin, they saved $19 in procurement costs for genuine product. Across their entire network, the annual savings exceeded $200 million. The operation extended to blood pressure medications, cholesterol drugs, anticoagulants, antibiotics, and dozens of other common prescriptions. The selection criteria was brutally pragmatic: high volume, expensive procurement cost, and adverse effects that would develop gradually enough to obscure causation. The counterfeit production facility operated 24 hours a day, 7 days a week, manufacturing fake medications that would flow through HealthFirst's distribution network to 840 pharmacies serving 4.2 million customers. The scale of the fraud was unprecedented in American pharmaceutical history. The first break in the case came from a hospital emergency department in Oklahoma. An emergency physician noticed an unusual pattern in diabetic ketoacidosis admissions. Over 3 months, his department had treated 17 patients for severe diabetes complications, despite the patients reporting good medication compliance. All 17 filled their insulin prescriptions at HealthFirst locations. The physician documented the pattern and contacted the state health department. They initiated a routine inquiry. HealthFirst provided documentation showing proper sourcing and handling of all insulin products. The investigation appeared to close, but the emergency physician was not satisfied. He contacted the FBI field office in Oklahoma City. Federal investigators approached the case with skepticism. Correlation did not prove causation, and diabetic emergencies were common. But the agent assigned to the inquiry was a former pharmacist who had spent 10 years in retail pharmacy before joining the FBI. She understood medication supply chains, and something about the HealthFirst documentation seemed wrong. The sourcing records showed purchases from a distributor she had never heard of during her pharmacy career. She began tracing the company. Within 2 weeks, she had identified a shell corporation with no legitimate business operations beyond paperwork. The investigation escalated. The FBI obtained warrants to examine HealthFirst's distribution centers in 3 states. What they found was infrastructure that had no legitimate purpose in pharmaceutical distribution. Hidden manufacturing areas contained equipment for producing tablets and filling vials. Storage rooms held bulk quantities of active pharmaceutical ingredients purchased from overseas suppliers that were not registered with the FDA. Computer systems maintained dual inventory records, one showing legitimate purchases from licensed distributors, another tracking the actual flow of counterfeit products through the network. The evidence was overwhelming and terrifying in its implications. Laboratory analysis of medications seized from HealthFirst locations revealed the full scope of the fraud. Insulin vials contained solutions with active ingredient concentrations ranging from 15 to 40% of labeled strength. Blood pressure medications had inconsistent dosing that varied by up to 60% between batches. Anticoagulants designed to prevent blood clots contained subtherapeutic levels of active compounds. Antibiotics had insufficient drug content to effectively treat infections. The analysis covered 217 different products across multiple therapeutic categories. Not a single one met FDA standards for pharmaceutical quality. HealthFirst had built a nationwide network distributing fake medications to millions of Americans. The human cost became clear as investigators expanded their inquiry. Medical records from hospitals and clinics in HealthFirst service areas showed patterns that had been invisible when viewed individually, but became obvious in aggregate. Diabetic patients experiencing unexplained deterioration. Heart attack and stroke rates elevated in specific geographic regions. Infections failing to respond to standard antibiotic therapy. Cancer patients showing poor response to treatments. The statistical analysis suggested that counterfeit medications from HealthFirst had contributed to thousands of preventable medical complications. The precise death toll would never be known because many victims died from conditions that appeared to be natural disease progression. The true number likely ran into the hundreds. The FBI faced an unprecedented challenge. They needed to shut down HealthFirst operations immediately to prevent further harm, but they also needed to do so in a way that would not trigger mass panic about medication safety. 4.2 million Americans filled prescriptions at HealthFirst locations. Many depended on those medications for life-threatening conditions. An abrupt closure without a transition plan would leave vulnerable populations without access to necessary drugs. The Justice Department, FDA, and Department of Health and Human Services formed a joint task force to coordinate the response. They had 72 hours to plan and execute an operation that would simultaneously shut down a criminal enterprise and protect millions of patients. The takedown occurred on October 7th at 6 a.m. Eastern Time. FBI tactical teams executed simultaneous raids on 840 HealthFirst locations across 32 states. Additional teams secured the manufacturing facilities, distribution centers, and corporate headquarters. Pharmacy employees arrived for morning shifts to find federal agents inside their stores. The initial confusion gave way to shock as investigators explained the nature of the operation. Most employees had no knowledge of the counterfeit scheme. They had been filling prescriptions with products they believed were genuine. The betrayal was complete. The company had used its own staff as unwitting accomplices in a massive fraud. The logistics of the operation were staggering. The FDA activated emergency protocols to coordinate with legitimate pharmaceutical distributors and pharmacy chains. Within 6 hours of the raids, alternative pharmacies in every HealthFirst service area were prepared to accept transferred prescriptions. The federal government provided emergency funding to ensure continuity of care for patients. Public health officials worked with media outlets to communicate accurate information without causing panic. The message was carefully crafted. Medications from HealthFirst were compromised. Patients should contact their doctors immediately to verify their treatments, and alternative pharmacies were ready to serve them. The transition had to be managed precisely to prevent a health care crisis. The evidence seized during the raids filled multiple warehouses. Financial records documented 8 years of systematic fraud. Computer systems contained detailed tracking of counterfeit production and distribution. Internal communications showed full knowledge and participation by the senior executive team. The founder, who had presented himself as a healthcare reform advocate, had personally approved the expansion of counterfeit operations to maximize savings. Quarterly reports to investors had disguised the fraud savings as operational efficiency improvements. The company had built its entire growth strategy on the foundation of pharmaceutical counterfeiting. The scale of the conspiracy extended beyond HealthFirst itself. The investigation revealed connections to organized crime networks that specialized in counterfeit pharmaceuticals. The overseas suppliers who provided substandard active ingredients were linked to facilities that had been shut down by foreign regulators but continued operating through shell companies. The distribution network included freight companies and logistics providers who handled counterfeit products without knowledge of their nature, creating additional layers of deniability. The full operation involved more than 300 individuals across 8 countries. Federal prosecutors charged 47 defendants, with crimes ranging from conspiracy to commit fraud to distribution of misbranded drugs to racketeering. The senior executives faced additional charges related to endangerment and willful violation of FDA regulations. The evidence against them was documented in thousands of pages of internal communications that showed clear awareness of the harm their actions could cause. One email from the founder, discussing the expansion of insulin counterfeiting, stated, "Short-term adverse events are acceptable business risk compared to long-term profit margins." That single sentence would be quoted throughout the trial as evidence of depraved indifference to human life. The public health response continued for months after the initial takedown. The FDA issued nationwide recalls for any medications dispensed by HealthFirst locations during the previous 3 years. Patients were instructed to bring their medications to legitimate pharmacies for verification and replacement. The federal government covered the costs of medication replacement and additional medical care for patients harmed by counterfeit drugs. Thousands of individuals came forward with stories of unexplained treatment failures that suddenly made sense. The aggregate picture painted a portrait of systematic betrayal of patients who had trusted a company that claimed to care about their health. The investigation also revealed how the fraud had gone undetected for so long. HealthFirst had exploited gaps in pharmaceutical oversight and supply chain verification. State pharmacy boards conducted compliance inspections, but they focused on procedural adherence rather than medication authenticity. Prescribers trusted that pharmacies dispensed genuine medications. Patients assumed that licensed pharmacies adhered to legal standards. The system depended on trust, and HealthFirst had weaponized that trust to hide a criminal operation in plain sight. The company had even passed external audits by using a sophisticated system of real and fake inventory that allowed them to present genuine medications during inspections while distributing counterfeits during normal operations. The financial analysis of HealthFirst operations showed a company that had been fundamentally unprofitable without the counterfeit scheme. The aggressive pricing and community programs that had earned them praise were only possible because they were dispensing fake medications that cost a fraction of genuine products. The entire business model was built on fraud. When investigators calculated the true cost of operating a legitimate pharmacy network at HealthFirst's prices and service levels, they found that the company would have lost money every year of its existence. HealthFirst was not a mission-driven company that had made a wrong turn into criminality. It was a criminal enterprise that had used healthcare advocacy as a disguise from the beginning. The court proceedings became a focal point for discussions about pharmaceutical safety and corporate accountability. Victims testified about health complications that had devastated their lives. Medical experts explained how counterfeit medications had caused harm that legitimate treatment could have prevented. Economic analysts calculated the broader cost to the healthcare system: unnecessary hospitalizations, additional treatments for complications, and long-term care for patients who suffered permanent harm. The total economic impact exceeded $3 billion. But the human cost could not be measured in financial terms. Families who had lost loved ones to conditions that counterfeit medications had failed to treat or control sat in the courtroom watching the defendants face justice for actions that had stolen years of life from people they loved. The sentences reflected the severity of the crimes. The founder received 40 years in federal prison without possibility of parole. Other senior executives received sentences ranging from 20 to 35 years. Lower-level participants who had operated the counterfeit manufacturing facilities or managed the distribution networks received sentences of 10 to 15 years. The company itself was dismantled entirely. All assets were seized and liquidated, with proceeds directed to a victim compensation fund. The HealthFirst name was permanently banned from use in any healthcare-related business. The message from the Justice Department was unequivocal. Companies that betray public trust in healthcare safety will be destroyed completely. The regulatory response to the HealthFirst case transformed pharmaceutical oversight. The FDA implemented new track and trace requirements for all prescription medications, creating verification systems from manufacturer to patient. Pharmacy chains were required to implement enhanced verification protocols. State boards increased inspection frequency and added authenticity testing. The discovery prompted reviews of other pharmacy operations, identifying several additional fraud cases, though none matched HealthFirst's scale. The trust that patients placed in their pharmacies had been shaken, and healthcare providers found themselves answering questions about medication authenticity that had never been asked before. For the 4.2 million patients who had filled prescriptions at HealthFirst, the betrayal was personal. Many had chosen HealthFirst because the company's mission aligned with their beliefs about accessible health care. The discovery that their trusted pharmacy had been endangering their health created trauma that extended beyond physical harm. Support groups formed for victims, providing spaces to process both medical and emotional consequences. The Oklahoma emergency physician received recognition from the FBI and medical organizations. His willingness to trust his clinical instincts had initiated the investigation that prevented years of additional harm. He continues working in the same emergency department, now routinely questioning unexpected treatment failures and maintain an FDA contact to report concerning patterns. His experience demonstrated how individual vigilance could detect systemic problems that institutional oversight had missed. The FBI agent who had pursued the initial lead, despite skepticism from her colleagues, became a specialist in pharmaceutical crime investigation. Her pharmacy background had given her knowledge that was crucial to recognizing the anomalies in HealthFirst's operations. After the case concluded, she led the development of training programs for federal agents on pharmaceutical supply chain security. The FBI established a dedicated pharmaceutical crime unit based on lessons from the HealthFirst investigation, working closely with the FDA to identify and dismantle counterfeit operations before they can reach patients. The scientific community studied the case to understand how counterfeit medications had caused harm without triggering faster detection. Research contributed to new technologies for medication authentication and created databases of known counterfeit markers. The case became a teaching example in pharmacy schools and medical education programs, warning future healthcare professionals about what could happen when profit motives overwhelmed professional ethics. The Victim Compensation Fund, established from seized HealthFirst assets, paid out over $400 million to more than 18,000 claimants. But for many recipients, the money could not restore their health or bring back their loved ones. The fund administrators acknowledged that assigning monetary value to harm caused by counterfeit medications was an impossible task that could never fully compensate victims for their losses. Today, the pharmacy locations that once operated as HealthFirst have been acquired by legitimate chains or closed. The buildings that housed counterfeit manufacturing facilities have been demolished. The physical infrastructure of the criminal enterprise has been erased, but the impact continues to shape American healthcare. Every patient who picks up a prescription carries awareness that the system can be compromised. Every pharmacist operates with heightened vigilance. Every regulator knows that trust alone is insufficient protection against sophisticated fraud. The HealthFirst case demonstrated how criminals could exploit the complexity and trust-dependent nature of healthcare systems to cause mass harm while hiding behind a facade of social responsibility. The company's mission statements, community programs, and advocacy positions were not evidence of genuine commitment to patients. They were marketing tools designed to build trust that could be exploited for profit. The more effectively HealthFirst presented itself as different from traditional pharmacies, the more easily they could deceive patients, providers, and regulators. The lesson was stark. In healthcare, reputation and reality do not always align. The FBI prevented a complete collapse of public trust in pharmaceutical systems by acting decisively once the fraud was discovered. If the investigation had leaked before the coordinated takedown, if patients had learned piecemeal about counterfeit medications over weeks or months, the panic and uncertainty could have triggered a broader healthcare crisis. People might have stopped taking necessary medications out of fear. Emergency departments could have been overwhelmed with patients demanding verification of their prescriptions. The careful coordination between law enforcement, regulators, and healthcare providers prevented worst-case scenarios while still holding criminals accountable. But the case also revealed how close the country had come to a far worse outcome. HealthFirst had been planning an expansion into specialty oncology medications when the FBI raids occurred. Internal documents showed proposals to begin counterfeiting expensive cancer drugs that could save the company even more money. The patients who would have received those counterfeit medications were among the most vulnerable in the healthcare system, fighting diseases where treatment timing and dosing were critical. The harm that expansion could have caused was difficult to calculate, but the potential for mass casualties was evident. The Oklahoma emergency physician's initial observation and the FBI agent's persistence had stopped the operation before it entered its most dangerous phase.